Hello, hello, hello. This is Truth Be Told. This is Dr. Walter Aka.
And you already know who this is, Leroy Horton.
We are back. We are back, and we got more questions and more answers, and hopefully, we're answering and providing some gems for people. I think we are. I feel
You
good
know,
about it.
sometimes I wonder if we just give the old man perspective. Because I really try to put myself in the position of a young, mid-20s, late 20-year-old
Right.
graduate in the
Right.
2024 era. And I don't want to be that old man that's like.
Okay. Let me ask you a question. This question was brought to my
Mhm.
attention. And I want your honest opinion.
Okay.
Okay, you have a son, you have a
Hmm.
daughter. Okay, so you're the perfect
Do.
fit because I can ask
Yeah.
you either way, and there's no gender bias or anything, right? Because I don't want to
Right.
get canceled. So either one, your son or daughter, would
Right.
you advise them to go into dentistry?
That's a great question.
And
So,
again, I want people to know that we didn't plan this. This is me
right.
legitimately asking you this question. Would you advise your kids to go into dentistry?
Yes. All three, I've actually tried to talk them into dentistry at some point in their lives, but primarily because I knew that they would have me for guidance, support, learning, and that transition from graduating to starting your career. I feel like I've learned enough hard lessons to where I could, both on the financial end, on the educational end, on just everything, I could really guide them to a much smoother start and acceleration into their career. If I knew like, hey, I'm gonna tell you go to dentistry, but I'm gonna get hit by a bus tomorrow, so I'm not gonna be here to guide you. I would really think twice about it. I think right now it's a very difficult field to come out with your sanity intact the first 5 years. We all kind of figure it out eventually. Some of us become, bitter in certain arenas, but I think those that do best seem to be the ones who have a parent, have an older sibling, have a family member where they're walking into a system. Whereas a lot of us that kind of are like, hey, I'm a dentist. What do I do now? There was a lot of just walking straight face first into walls.
Right,
You know what
right,
I mean?
right, right. Huh. I'm not sure if I would.
Mm, tell me
And
about it.
I'm not sure if I would. And the reason why I say that is because I think dentistry has gotten to a point where it used to be where you can, even if you didn't enjoy it, you did it and you were paid well, you had a great life. There was not much stress to it.
Mm,
I feel like now there's so many outside factors that if you don't like it, you're going to be miserable.
see that.
Patience, insurance,
Mm,
everybody is an expert. You got people that aren't even dentists doing dentistry. You got
that is true.
assistants doing whitening in people's houses. You got
Right.
assistants trying to straighten people's teeth. You got people that are you got people that do nails trying to do veneers. Now I saw this. It was craziest thing I've ever seen in my life.
Right.
She did nails and she said, I also want to learn how to do veneers. And she thought the correlation was there where acrylic and acrylic on people's teeth were exactly the same to her.
Well, it's clearly a natural progression, right? You
According
go
to this,
from
according to
nails
this person, it
to
was.
teeth. Yeah, I mean, I see that, right? Straight
Yeah.
line.
So you're right. Why wouldn't that be the case? So to me,
Right.
I look at it like this: if I can argue, then I should be a lawyer. That's
Hmm.
how. If I can argue really well against who is better, Kobe or LeBron, then I should absolutely defend you in a murder trial. Same same trajectory. I
Right.
see how I don't see how this is any different.
Right.
So
Right.
let me know. I'll have my advertisement out soon for my law firm with no degree. But that's what I'm when I say that I really do mean like they have
Mhm.
to show a lot of enthusiasm, excitement,
Right.
right? Like for example, today I went to get my teeth cleaned today, and I'm not a hypocrite. I don't have perio. Yes, I made sure that I was because the assistant, who I go to is also the one that I'm sorry that the hygienist that I go to is also the one that we work well together and so forth. So
Right.
she's like, you better not have any perio. And I was like, yeah, I better not.
This is
Uh,
Walt flossing for a whole week
right? You know it.
before
You know how
your
it is.
appointment just to make sure.
Exactly. I was like, let me be fake about this. But they gave me the fluoride,
Mhm.
the fluoride you apply, the varnish, okay? And what I did was I brought it home and I basically had my kids, they put gloves on, they put it on my teeth.
Oh, that's
That's the
cute.
kind, yeah, that's the kind
Yeah.
of stuff that I'm like, oh, let them do this and then it'll be fun and they'll get excited about it. But am I going to push them towards that? Nope. Am I
Mm,
going to, I want them to naturally develop and say, yeah, I actually like dentistry. I want to pursue dentistry because I really do believe that if you go into it thinking, oh, mom and dad are here and you're basically just trying to follow my path, and my path was way different than what your path is going to be. What does
right.
dentistry look like in 10, 15, 20 years from now?
Right.
I can guarantee you it's not going to look like what it does now.
So
I
what
think
what
it's
I'm
going to be
hearing,
harder.
Walt, is that you're very Americanized. You're no longer an African parent.
Yeah. Oh, no,
Because
no, no, no.
because
So
you're telling your kids they have the freedom to choose what makes them happy
I never once said that.
versus
I never
this
once said
is
anything about happiness. I refuse to ever say anything about happiness because if that was the case, they could be philosophy majors. So that's not happening.
Hey,
That's
we
not
need
happening in my house.
philosophy.
That's not
We
happening in my
need
house.
philosophy.
Yeah, okay, and then go ahead and get the debt associated with it. Cause yeah. Anyway, I never said anything about happiness. I said they
Right.
should not go into dentistry if they're not
Mhm.
passionate about it. But one
Okay.
thing we're gonna be is we're gonna be passionate about whatever job we do.
Right.
Because I'm not going to have you half-ass anything.
Right.
That I can't deal with that. If they decide to be artists, they better be a goddamn incredible artists where they're out there putting their stuff out there. They're not just sitting at home hoping someone's gonna find them and
Ah,
what I
for
mean,
sure.
discover it. I want them to work. I don't care what you do, work your and be the best that you possibly can be at it. But you gotta have
For
passion for
sure.
something.
For sure.
Yeah.
But okay. So my business partner that we interviewed in our show,
Yeah.
two of his sons are dentists, one's went into medicine. I saw that their ability to have opportunities for shadowing, working in a dental office, knowing people to get letters of reference, getting into dental school, having the financial wherewithal to pay for stuff, coming out using his connections and building offices and buying from vendors at lower prices because hey, that's his dad. We've been working him for
That's it.
years. It makes so much sense though.
Oh, and I agree
If
with you.
in that scenario,
That's it.
and that's where I really wanted my kids to follow my footsteps. A, so we can share in this interest in this topic that I've had a passion for years, because you want to be able to share that with people you love.
Right.
But it also made sense. I mean, how many families do we see where the kids just follow in the family business?
That's it.
Why is that wrong for dentistry? Why would you not push them to join the family business?
And that's but the difference is when people join family businesses, it's almost kind of like they're at like let's just say you have a construction business. They're
Mhm.
not doing the dirt, they're not doing the dirty stuff. They have people that are doing the dirty stuff. In dentistry, you're doing the dirty stuff. You see, you run the office, but you're also yeah in construction. If you're the construction, if you're the guy that owns the construction company, most of the time you're not the one putting up the wall, the drywall, and stuff like that. You may know that information, but you're not the
Oh,
one actually. You're hiring people to do that. You're overseeing them, correct?
no, of all your, I think the vast majority of your construction companies are small mom and pop construction companies
Okay,
where they have workers that work for them, but
right.
they're hands on.
I mean, they're there.
Yeah.
They're supervising. They're
Oh, they
on.
no, they're
You think
hands
they're putting
on.
up drywall and stuff?
Oh, absolutely,
Okay,
absolutely.
I could be wrong.
Yeah, and and then, for example, like I've had two contractors that have worked on my house
Okay,
and my offices. And they are the head honchos of their company,
right.
and they always had 4 or 5 workers, but they were
Yeah.
there working with them.
See, I've never seen
you know?
contractors do that. I've seen them literally
Yeah,
looking at the plan and say, making sure that no one screws up anything where it hits them financially.
right.
You see what I'm saying? I've never seen them being like, okay, yeah, I'm gonna go ahead and put this up. They're like, hey, you guys need to put this wall up, and we need to do this, this, and this, and they direct people to do stuff. You
Well,
see
that's
what I'm
because in
saying?
Texas, y'all get that immigrant labor for mad
And
cheap, so
okay,
so
see,
they can.
see, see, this is
That's all
exactly
Texas
how
is
we're not
about,
gonna do
right?
it. We're not going that way. But what I'm getting at is, oh, here's another factor too.
Okay.
Just because you're skilled, and this is a difference in dentistry as well versus construction, right? Construction, you can learn the trade, right? But in dentistry, let's just say you're a cosmetic dentist.
Hmm.
You have hand skills that most people probably don't have. You have ability to see, shapes, angles, and so forth that other people don't have. It's an art craft. It's an art that you have acquired, right? And
Hmm.
I honestly think you have to have a level of natural art talent in order to excel to the level of a really good cosmetic dentist.
Right.
Let's just say your son or daughter has the same skills.
But can you develop them?
You can develop, but you're probably not going to be to that level.
Right. But I mean, they don't have to do
Because
cosmetics. They can just do general dentistry. They might have a knack for surgery
well,
or
but you built a
prosthetic.
cosmetic practice. Now you're telling them to change the whole entire game plan here because cosmetic and surgery are very different. They're
No, because a lot of cosmetic surgeons bring in specialists to do the in-house
Yeah, but
implants.
they do cosmetics. They're doing the rehab part of it. They're not doing the surgical part of it. Does that make sense? Meaning that,
No,
like, go ahead.
but if I'm a cosmetic dentist
Yeah,
and I restore implants,
right,
and my son or daughters want to go and become periodontists,
right.
now they can place the implants on my patients and I restore them.
But then, when are you going to retire? You're never going to retire.
Well, I
Do you,
can if I want to, but
no, but do you see what I'm getting at? You said you want to basically groom them to take over. How
no, no,
can you
no. I
do
wasn't
that
saying
if
groom them to take over. And when you take over, then they can take over the business and then they can hire a cosmetic dentist in the same way that I would hire a surgeon. I think we shouldn't oversimplify it. I mean,
okay,
I don't think, honestly, I don't think dentistry is that magical of a profession. Because I tell you this, my father-in-law was in construction for 35 years, right?
okay,
He's a carpenter, union
hmm,
carpenter.
yeah,
The woodwork that he does is so beautiful
that's it.
and artistic.
That's it.
I mean, he's made me some homemade knives because he has a forge in the backyard, and just the artistic work on the wood handle that he does. So I think there's plenty of skill to go around, and a lot of people can learn and develop enough to at least be good. Some people are going to be naturally excellent at something, excellently, at surgeons, at cosmetics, at whatever. Some people are good enough to be good, right?
Well, what if you're excellent and your son or daughter is just good? Do you think that the same quality of patients are going to be going to your child? You've built something where people are now coming and paying a substantial amount, right? Because of the quality of work.
Hmm.
And then you have somebody coming in to take over, and that same quality of work is not there. The same attention to detail may not be there, right?
Well, I
What do
mean,
you do
I
in
think
that
that
situation?
that could be said for any industry,
No, but
honestly.
what I'm
I mean,
saying is like, what do you do in that situation? To me, I get the idea if they say, "Hey, I want to continue the family business," I think that's easier in other fields than it is in dentistry. I really do. I think it's easier in medicine. I think it's easier in, like I said, construction. I think it's easier in tech. I think it's easier in other fields. I just don't think it's that easy in dentistry because dentistry marries art and science together. And some people are very good with the art, and some people are very good with the science.
yeah, I don't know. I think there's a lot of legacy practices that seem to be doing just fine. I mean, because if that's the case, then we would never hire associates because an associate can never do anything as good as me, right? Whether it's
Well,
it's son
and
or
and
daughter
don't
or
right, and don't you limit what associates can do when they first come
well,
into your practice?
until they develop, right?
Right, right.
And so you'd hire your kid out, your kid comes work with you after they graduate, and you give
Mhm.
them the easy stuff, and then
Right,
over time, the more complicated stuff, and you help
right.
them develop.
Okay.
I just think do you like your kids, Walt?
I love my kids.
I want my kids around.
I love my kids. That's why I'm telling them not to do dentistry. Like, I want them to be as happy as they possibly can. I
Right,
want them to basically say, you know what? I am not forced to do this. My dad loves doing this. He loves the podcast. He loves, lecturing. He loves doing all this stuff that's dental related. I may not have that
right,
same vibe. I'm okay with that. I just don't think that I need to sit there and say, oh, let me wait for them to then take over my practice before I quit
right.
or I retire or whatever it may be. I
Well,
think this
I
is my
think
path.
let me translate for the people because I think I get what you're saying.
Okay.
What you've seen over the years is that you can see how miserable one can be if they
Yes,
don't love this,
that's it.
and you don't want that for your kids.
At all.
There's other jobs where people can do to make money
Yeah,
while they pursue their other interests.
absolutely.
Barbecuing on the weekends, traveling, vacationing. It's the end, it's a means to an end.
Right.
This is a job, and this is for everyone listening, whether you're thinking dentistry or you're in dentistry. If you don't truly like it and love it, you can be extremely, extremely miserable.
That's it. And it can
And I
beat you
don't want
down.
anybody, whether
Yeah.
they're my kids or not, to
Yeah.
be in a job. Let's put it this way: from a patient's perspective, I don't want you doing a procedure on me if you're miserable doing
That's it.
it.
That's it.
You know?
That's exactly right. That's exactly right. And it's not to say that I don't love dentistry. I think dentistry is the best thing you could possibly do. I
Mm,
really, really enjoy dentistry. I don't know if in 5, 10, 15, 20 years, dentistry is going to look the same. I
right,
don't know if the stuff that we were privileged to have and to do, they're going to be able to do the same thing. I'm not sure what technology is going to look like. I'm not sure what could you actually even open your own dental office without being run over by like a Walmart of dentistry. And I
that
already
is
see a
true.
Walmart of dentistry coming up.
Yeah,
I see multiple Walmarts of dentistry.
right,
Are you going to be run over by that, right? Because everybody says you go to a small town and you have mom and pop shops, and all of a sudden you get a Walmart in there, and the mom and pop shop can't compete.
exactly.
So I'm seeing more and more of that. So again, I'm seeing the trend, and I'm saying to myself, is dentistry a great field? Is dentistry the best thing that ever happened to me? Absolutely. But is dentistry something that I see changing? And I see a lot of dentists, especially since we get to talk to people on this podcast.
Mhm.
We talk to a lot of people, on and off camera, and we know the truth and we see where
Right.
everybody says, and we hear what everybody says. And I'm like, I'm not hearing everybody going high-fiving each other.
No.
I get a lot of people talking about they're burned out and stuff. We just did an episode about that.
Yeah. Yeah. So Walt, if you won the lottery today, you never have to think about money again.
Yeah,
Would you still do dentistry
in
or
a
would
heartbeat.
you not?
I would absolutely do dentistry. I'm telling you when I say, remember when we interviewed Dr. Dennis and he was surprised that I gave up my time to volunteer? Remember that? Like,
It was like you were speaking a completely foreign language. He was like, "What?
you
What is this volunteer word?"
right, and you had to pay your insurance, but yet you still want. And I said yes because I really do love what I do, and I do think that I've been blessed enough to give back. So
Right.
if I had money was not an object, I still would be doing dentistry.
Yeah.
I would.
Same
If
here.
anything, I might actually just travel and do dentistry for sure without having to be one local area. I might be
Right.
like, I'm gonna spend a month in Africa. I'm gonna spend a month in Asia, and just doing that way if I could.
Right.
You see what I'm
Right.
saying? Like that I might actually do more of that than anything else. But again, this is the difference. Like you and I have something that we find very, very enjoyable in
Right.
dentistry. And I'm not saying that everybody has that, and I want everybody to have that. But I also understand that some people feel like, oh, I went into it because hey, I was gonna make good money, and then I'm like, man, this is worth it,
Right.
right?
Well, listen, you hear all the time, we said it last time, you hear all the time you should be a doctor, dentist, or lawyer, right? When you're growing up. So there's that mystique around it.
Yeah.
There's the mystique of the fallacy of, oh, you're $1 million dentist. Every dentist is rich, which is not the
Not.
case. It's like every MD is not rich, right?
And we talked about in the
Are
last
you,
episode.
yeah,
We broke
are
it
you well
down.
to do compared to the global standard?
Yeah.
Absolutely. Compared to the American standard, for a
No.
lot of us, let's say you make 190,000, but your school loans are $3,000-4,000 a month. It takes a while to get there, but you will as long as you stick with it long enough, you will absolutely be fine. But a lot of people think that you should walk out the door with your cap and gown and golden paved roads just
Right.
lay ahead of you.
Yes.
And that's just not the case.
Now I can go to that really expensive neighborhood and buy a house in there. You know what I
Right,
mean?
right.
And my family's gonna be all Louis Vuittoned out and stuff like that.
Okay.
That doesn't happen.
But let me ask you this, man,
Yeah.
because we've had some friends of ours who are trying to teach you how to retire. And we just talked about what happens if money was not an issue. I would absolutely still do dentistry. Would I do it 5, 6 days a week?
No,
Maybe not.
no,
Right.
I would
No,
not. I don't do
no.
that now. I'm not gonna
Right.
do that. I'm not gonna.
Right.
If money's an issue, I'm definitely not doing that. You know what I mean?
But here's the question. What is this dream that we've been sold that at some point, or you should look at your profession as something you're eagerly awaiting the moment to be able to disconnect from?
Mm,
I love dentistry, and that's why I set myself up with going to residency and getting into research and academia. So that way, when I'm too old to physically practice, I can still contribute,
right.
whether it's research, whether it's teaching, I can still be around it because I really do love it that much.
Right.
Why do so many people, especially dentists, have this notion of, oh, I'm going to retire and sail off into the sunset and just fish all day,
Well,
as if they don't have a true interest and passion in this?
but that's not just dentists. That's everybody. You know, one thing that I noticed, I remember I went to what was it? It was like Italy for my honeymoon.
Mhm.
And we were there kind of off season, and we were sitting in a bus, and we were going to go to Pisa, the Leaning Tower. And one, by the way, it's I hate that place. It's so hyped up. It is the
Really?
dumbest place. Sorry, anybody from Italy listening. It's a dumb place. There's nothing around that leaning. You take pictures of it leaning, and then that's it. It's
And that's
dumb.
it.
Anyway, sorry. I digress. I apologize. It really irritated me because it took an hour to get there, and then we were there for like 2 hours because the tour guide was like, "Oh, you take all the pictures," and I'm like, "What else is there? There it is. We're done." You know what I
Did you
mean?
take the picture where you're like holding it
Oh, you
up
know I did, and then
and
I was done. That's it, and then I was done. That's 5 minutes.
Right.
But but anyway, so I was talking to some people. I was like a couple, and then he was like, yeah, I think it was in the 60s, late 60s. And he's like, man, I've been waiting so long to come here. I've been waiting so long to retire so that I can then start to travel. And I
Mm,
thought to myself, and they were American, and I thought to myself, that is exactly what has been built to Americans is work hard so you can retire and then have fun. But most
right.
people, when they retire, they're either too old to enjoy it
Or
or
sick.
can't enjoy it or whatever it may be.
Yeah.
But the funny thing is, then I talked to a European couple, and they were like, no, each year we go on about 2 vacations.
Mm-hmm.
And I was like, I'm sorry, what? They're like, yes, we go on 2 vacations and we go. And I'm not saying that they have the financial means to do that. What I'm saying is, I think we have to start thinking of work differently. That
Right.
it's not just work, work, work until you break your body down and then have fun.
Right.
I think you say in a year, I work, and then the rest of it, I'm going to go ahead and save up, and I'm going to take even if you took your family to the next state,
Yeah.
you're not working.
You're not working. You're
You get to enjoy
disconnecting.
yourself a little bit
Yeah.
versus waiting to say, I'm going to go see Yellowstone when I'm 68.
Right.
Like,
Right.
eh, eh,
But
and no, and no, go ahead.
how much of that is allowed? Because our culture is so consumer driven and productivity driven.
Right.
You're not going to be able to keep your job if you take and by extended, I mean a week and a half. If you try to take two 10-day vacations from your job, whether it's paid time off or unpaid time off, you're probably going to get fired.
And that's the problem.
You know?
They've no, seriously, our society has made it where if you aren't first in, first out, you're slacking. But the funny
Hmm.
thing is, if you look at people's actual day, most of the time is spent BSing anyway.
It really is. It really
It
is.
really, really is. Most people spend most of their day BSing.
Mm.
So you're telling me that just this for the looks of it is what we're doing
Right.
all this for. I think
Right.
our culture, I think the American or the Western mindset needs a big reset. This is why I'm not a psychologist, I'm not anything but a dentist, but I can see the misery in everybody. And we wonder why people are depressed. We wonder why people are anxious. If you go home and your boss is calling you, in other countries, that's illegal. I know
Right.
that is in Spain. I know that is in Japan. I know you're not allowed to call your worker when they go home.
Right.
In other countries, that's not right. You can't do that. It's actually against the law.
I was so guilty of that. I was always so guilty because when you own the business, that's your baby.
That's
So
it.
you often don't realize because you're just like, all right, every responsibility is on me to make payroll, to make sure the patients are set for the next day, to make sure that I'm walking into, and we do that out of this nobility of I want to make sure my patient comes in and their experience from the first foot in to when they're walking out, everything is calm, organized, set, and that does take a lot of work and managing. And sometimes you just don't have to you don't have time to do all of that within that work day because you're currently checking in patients, checking them out, doing the surgeries, doing. So I kind of feel bad. I was always very guilty of sending those, 8, 9 p.m. texts like, hey, you guys did do this for this. You guys did call the patients or you guys did whatever.
It's
But
illegal in other countries what you're doing.
yeah, I was lucky in that I had managers that, and staff that understood and,
Yeah.
they also didn't hesitate with I bought loyalty
Mm-hmm.
because I did a lot of work on my staff's families.
Mm-hmm.
And I guess that's a good thing because that means when your staff will bring their mothers, their kids to you, that means that
They
because
trust
they
you.
see your work day in, day out. So
Yeah.
that's always a compliment.
Right.
But also it's hard for you to not be giving above and beyond for someone that did free work
Right.
on your mom and dad.
True, but are you taking advantage of that? Right? Is it a I do
Yeah,
this for
you can
you,
make that
you do
argument.
this for me? That shouldn't be the case.
Well, no, what's wrong? What's wrong with the barter system?
No, that's not a barter system.
Yeah,
That's a tit for tat system.
no.
A barter system is within a certain parameter. You said you went outside of the parameter and you're calling people at 9, 10 o'clock at night. That's not
Well,
right.
yeah, because they also had the freedom to say, "Hey, on a Saturday,
Okay.
my child broke his tooth. Can you come in?"
Right.
And I would do that. So I felt like that's where that relationship and exchange was. Is
But
I'd go
you
above and beyond for them, they would go above and beyond for me.
but you just said that what you did was not right.
No, I didn't say it wasn't right. You had already framed it as it's
Uh,
illegal. So I was just
okay.
saying, hey, I'm guilty of that because
Okay,
I would do.
so
Because it's legal here, right?
do you think what you did was now that you know now that you know this, do you
Right.
think that would you do that again? Or would you say, you know what, I could always wait until another time to have that discussion?
Yeah. I mean, you could definitely. I think now as I'm older,
Right.
I think that everybody should be able to clock off and
That's it.
disconnect. I think it's healthier. It probably increases productivity overall.
And
Um,
don't get it
yeah,
twisted. I've done the same thing. I literally did that
yeah,
today.
right, right,
I'm serious. I do. And I'm not gonna sit here and pretend that I'm holier than thou. I've texted
right,
office man, hey, did you guys do this, this, and this? He's like, yeah, we did, but I'm home now with my family. I'm like, oh, my bad. And I said it. I'm like, oh, I am so sorry. Like, ignore me.
right,
You know what I mean? I say ignore, and
right.
they just laugh like, okay, yeah, okay. So I'm
I
not gonna continue that conversation.
I did that with our executive director for the dental society. I knew it was late, but I told myself I was like, if I don't send this now, and iPhone. So I used to have a staffer that she could, I don't know if it was an Android or what, but she could schedule her texts.
Mm,
So she would put a text and then set a time for it to actually send.
that's an
The
Android.
iPhone doesn't let you do it.
Yeah,
And
that's an
I'm of the
Android.
mind that if I don't send it now, I'm probably going to forget. And this is
Yeah,
important.
right.
So I sent her a text. I said, hey, if you're sleeping or you're doing anything else, ignore this and text me in the morning.
That's it.
Here's my question. you know?
Caveat and then. and then still say whatever you want to do. All right,
Right.
let's jump to I don't think we can solve the world's problem.
Mm-mm.
And I do believe in kind of turning everything off, but let's just answer some questions. Ready?
Okay.
Do you think, what do you think about water picks? Some people say that water picks are incredible, and we're using the trademarked water pick name, but any kind of water
Hmm.
flosser, we'll call it that, right? Do
Right.
you Some dentists say nope, water pick by itself is not good. Some dentists say, yeah, absolutely. Some hygienists say, absolutely, water pick is incredible. Some hygienists
Right.
say, no, in combination. If a patient came to you and says, I have a water pick, what do you think about it? What would you say? And how do you use it properly?
I'm pessimistic because to me, I'm happy if you're brushing properly.
Okay.
What I feel a water pick does is make people feel like they can skimp out on everything else.
Mm,
Because most everyone that comes to me that says they use a water pick, their oral hygiene does not look as good as they would purport it would be with this technology that they're using.
okay.
So what that tells me is, all right, are you only brushing 30 seconds so that you can go through with your water pick and then you're done? Like if you just brushed for 2 minutes properly,
Mhm.
whether you flossed or used a water pick or not, I'd be happy with that as a starting point because I just don't feel I feel like if it's used right, there's an added benefit. I just don't think most people are using it right in the same way that most people don't brush right. Right? They have a toothbrush, but we see all the time people not use it or not use it correctly because they come in and I brush 3 times a day and it's like 100% plaque
Mhm.
score.
So what would you
Um,
use? How would you use the water pick properly?
well, you depending on the brand and how it's built, you have to place it at the gum line at a specific angle, right? And you press the button and it starts shooting out water, and you have to sit over a sink because that water has to go somewhere,
Right.
right? It can be a little
Right.
messy. And what you really want to do is you want to trace your gum line at a specific angle so that the water jet is actually shooting into the gum line,
Mm,
right? So it's getting underneath the gums as much as possible, and then to between the teeth, and then you just keep going like that.
right. Would
It's
you
it's
use that by itself, or would you recommend in combination with flossing?
I'm always a big fan of mechanical removal
Mhm.
versus any type of propulsion or water pressure, just because I feel like it works better.
Right.
So I would say if I could say someone uses it with I don't trust anyone's gonna do 3 things. It's hard enough to get people to do 2 things, right?
Right.
So if you brush the way you're supposed to brush, if water pick is your jam, go ahead, as long as you're coming in on the recommended cleaning schedule.
Right.
I would prefer you use floss, but a lot of people don't even floss right? They kind of pop through the contact, jiggle, come out. They don't even
Okay.
get below the hug the tooth and get below the gum. So I don't know if I'm the right person for this question, man. I'm just
Well,
pessimistic with everything that I see. What
well,
about what
what
do
I what I normally tell people is this. I say, imagine if I came to you, and I'm going to use this analogy on you. Imagine if I came to you and I say, "Hey, I'm going to clean your car," and you're like, "Great, my car needs to be cleaned. Excellent." And I say, "Oh, where's the hose?" And you give me the hose, and I sprayed your car down, and I said, "All right, cool, see ya," and I walked
20
away.
bucks? That'll be
Yeah,
$20.
and I walked away. You'd be like, "Wait a minute, you didn't clean my car." You
Right,
sprayed my car down. So I got rid of the big chunk stuff, right? But I didn't get rid of the actual film on your car. That's what
right,
the scrubbing is for, right? And so that's why I say include the floss.
right,
Because the floss is actually going to get rid of what we call the biofilm, which is kind of like the area that has the sticky stuff that has the bacteria in it.
right,
That's what we're trying to get rid of.
right,
So if you can only do the water pick, cool, you've done something.
right,
But in actuality, what you want to do is include the mechanical, like you mentioned, the flossing in there, because that's what's going to get rid of that sticky, bacteria filled product. And
right.
then we know that we've done what we need to do.
And in all honesty, if you're gonna floss, then you technically don't even need the water pick,
Right,
right? So you can
right,
make that argument. Where I
right.
do where I do like the water pick is in like fixed arch cases where you might have spaces that could trap food.
So
Just to kind of
what he's basically talking about is like, let's just say you get implants or you have a bridge,
Mm,
basically, and you want to clean between the bridge and the gum. That's
right.
that's what he's talking about.
Right. So it can aid in kind of getting rid of large chunks of like stuck food that's stuck in there. You ate some bread. Like anyone ever have, braces or anything, you eat, some bread and you get these just really mushy pieces of bread stuck in the braces. Like water pick can be great for that because
Yep,
you can kind of blast some of that stuff off.
that's it.
Um,
Yeah.
but I'm not a big proponent of it though. I'm just
So,
I'm just
yeah,
not.
yeah. But if you have it, it is what it is.
So you
Use
can
it.
tell we're not sponsored by Waterpik.
By
Yeah,
we're not sponsored by anybody, so we
right.
can
We'll
talk
make an
trash all we want.
episode talking about, I have 5 of them and I use them every day once we get that sponsorship.
That's it. Oh, and then Waterpik is the best thing in the world.
Right.
But okay, so the next question, the follow up is, would it be good to add maybe the mouthwash to that water system?
Mm.
Now you're killing two birds with one stone. Is basically how a patient actually thought of it. What would you say?
Well, I applaud the creativity. I applaud that someone is thinking about ways to improve.
Right.
Um, I still think in what I've observed, as long as you brush and floss, whatever you put in the water pick, you're not really adding anything.
Right.
Or just rinse with the mouthwash,
Right.
you know.
I thought about that and I said that's a like you said, I was like, that's clever.
Right.
Here's a part that I'm not sure, and this is when somebody from the company can actually let us know. But that mouthwash, if it has alcohol in there, I'm not sure what it's doing in the line the line that actually sends the water through.
Mm,
I'm not
right.
sure if it's degrading over time or what. I'm not sure what it's made of. If it's
Right.
just breaking down whatever is in there, that's why we only recommend using water
Right.
versus something that has alcohol in there, or non-alcohol mouthwash, but there are other chemicals. So I
Yeah.
don't know, what you're doing to the line and if you're reducing the lifespan of that product. So for that case, I don't think you should.
Well, listen, I follow this pediatric dentist on IG named Dr. Polo, right? And he
Okay.
had this funny video where he's he had that filter making him look like a kid, and he was saying, "Yo, I got the solution. I use mouthwash, right? It kills 99.99% of bacteria.
Right.
So now I only got 0.01% of bacteria left.
Makes
So
sense.
I use it again.
Bam.
Bam, there you
Bam.
go."
Bam. I'm telling you, the world is better because knowledge,
He was a
knowledge,
thinking man,
knowledge. But yeah, okay. So we answered that question.
Okay.
And the question, I think the answer is, if you have a water pick, by all means, please use it. But I think the best thing to do is still floss.
Mhm.
Right?
I agree.
Everything kind of points to the best thing to do is still floss because the plaque, the biofilm, that's really what you're trying to get. And
Right.
I'm not sure, again, if anybody works for Waterpik or anybody and can show me otherwise, the mechanical removal is always the best.
It is, and I'll give someone a little bit of hard numbers. So in between the teeth, you have gum pockets, right?
Hmm.
Floss, and I believe this was a study by Warehog back in the day, is the only one that can get about 3 to 3.5 millimeters
That's right.
underneath the gum line.
That's right.
Okay. If you just rinse with mouthwash, it gets about, I think they said 0.2 millimeters underneath the gum line.
Yes.
So all that bacteria that's underneath the gums is like, oh, okay, that was cool, right? We had a blue light show, with some waterworks. Um, and I think water pick is only maybe like a millimeter, millimeter and a half if it's angled perfectly,
Right.
right? And so floss for in between the teeth is absolutely the best thing you can do to kill or disrupt the
That's it.
bacteria that's between the teeth that's contributing to that inflammation and that gum loss where you
That's it.
lose bone
That's
and
it.
gum tissue. So floss can be your best friend.
That's it.
That would be my 2 cents.
Right.
Yeah.
Okay, next question. So I was told to use a mouth guard, but I have
Mhm.
terrible gag reflex and just can't.
Right.
What else can I use to avoid grinding at night?
Great question. It's a great question. Do you have a gag reflex, Walt?
Okay, see, that's weird. You see,
I'm
no grown man
I'm
should
just
be asking
saying
another grown man
when
anything about gag reflex. See, this is exactly what you do. You find ways to make everything uncomfortable.
if
You don't
you
even
were
say
to
pause. You don't even say pause. So now it's weird.
so if you were to put a hard prosthesis in your mouth, would you gag?
You see,
Inquiring minds want to know.
I don't know why I'm putting anything hard in my mouth. I don't. I don't know why. I do. I don't. I'd rather grind my teeth down.
Listen,
I'd rather grind my teeth down.
in 2024, you can't even eat a hot dog anymore without getting clowned.
Oh,
You-
not the friends that
Bananas out the question, a hot dog's out the question, a corn dog's out the question. Anything that's phallic in shape,
you
just cut
cannot.
it up into
I
pieces.
stopped eating
You know?
vegetables for that reason. I stopped eating vegetables for that reason. You know,
Oh,
no
okay.
carrots for me.
No, no. Okay, true story.
Yeah.
So I had Invisalign
Mhm.
and I was doing it on myself, right? I scanned my own teeth, I had trays made.
Right.
I was like almost there, but around month 8, all of a sudden, every time I put the tray in over my teeth, I would just start gagging.
Mm.
And I was like, oh, what is going on? Like I've, 8 months I've been fine. So finally I had to go to my orthodontist buddy, Dr. Kashner, and he said, all right, we'll just put some braces on you, we'll finish you up. And within like a month and a half, 2 months, he like fine-tuned it.
Mm-hmm.
But gag reflexes are so instinctual and uncontrollable. They're very autonomic.
Mm-hmm.
And so I'm not sure what we can do, because usually you would think gag reflex on like a denture or something that touches the soft palate or the soft,
The roof of the
the
mouth.
back part of the roof of your mouth.
Mm-hmm.
But I can attest to that sometimes just having anything, even something as thin as an Invisalign tray, um, can activate it. And I don't know what the answer to that is.
Mm. Yeah. I mean, I don't, like you said, I don't know. There's so many different things that people do. They're like, oh, try salt. Like you've heard that, right? They put salt on
Mm-mm.
something. Yeah, they say I've had assistants like, oh yeah, just try salt, put it in the back, put it back there, and all of a sudden the gag reflex is not as bad. I don't know any
Really?
scientific evidence based on that. Some people
Yeah.
lift their legs up. I've heard that. Lift your leg up, and I'm like, that's a bit distraction, but okay. I've heard a
You're supposed
lot
to
of
you're supposed to just sleep like that with your leg up so you
Bro,
don't
I listen, I'm just telling you what people have said to try to do for gag reflex. Okay. I don't
right,
know how that makes sense, but people tell
right,
us, what I mean? It's always like an older, wiser assistant. It's like, oh, try this. It always works for me.
right.
But in all honesty, I have no clue. I mean, I remember reading that question. And I was just like, I don't know the answer to this one because it is something that you need, which is a grind. You have a mouth guard to help prevent you damaging your natural teeth. But if you're gagging, I don't know what you can do. Oh, actually, what? No. Okay, stop. Stop. I just thought of this.
Mhm,
If you're gagging because you have something that is covering all of your teeth from back teeth to the front, then maybe
mhm,
we can use an anterior posterior guide.
mhm.
An anterior posterior guide is basically like, or an anterior guide is a guide that just fits in the front part, the front teeth, and
Right,
kind of sits in the front teeth, and it actually keeps the back teeth from touching.
right.
The problem with that is long use has they've been shown to basically have what we call your teeth become super erupted. Is it a
Mhm,
lot? It's not, but it's enough to notice. So now your
right,
bite kind of changes. Okay.
right,
But if you do need something like that, an anterior guide, which is basically one that fits from like your canine to canine, you can just have it there and it keeps your back teeth from touching so that you don't have to go through um, um, that grinding motion, right? Your body
right,
doesn't say, oh, okay, there's something for me to grind, right?
right,
It's not connecting. So your back teeth are not connecting. So you can
right.
try that. What do you
You can
think?
definitely I think that's if your grinding is that bad,
Yeah.
then I mean that's your only option, right? And it's
Yeah, and
kind
you
of like
have gag issues.
yeah, and it's like pick your poison. Do
Right.
you want slight super eruption of your back teeth and your bite shifting over the years, or do you want to just wear your teeth down to nubs,
Right.
right? Um, I think the beyond that, that's symptomatic care. I would say, especially as I'm older now, like we have to start looking at, well, what could be potentiating this grinding?
Right.
Are you stressed out?
Right.
Is it work stress? Is it
Right.
kid stress?
Right.
Is there something you could do, a life change, whether it's exercise, yoga? I think we often ignore that in dentistry. We just say, all right, it's an oral symptom. We're going to treat the symptom. Boom, you're good. Um, and there's not as much interdisciplinary care, which I'll be honest with you, I went through a phase where I was like, you know what, I'm going to start referring people to, the holistic doctor down the street, or
Mhm.
um the therapist that deals with life stressors. Don't
Right.
nobody go. They're like, all
That's
right,
true.
doc, I got to work tomorrow, so I'll be back with my night guards in. You know what I mean?
There it is. So we're
Yeah.
so are you saying do you think that dentistry and maybe we'll leave here, but do you think dentistry is more of a reactive field now versus preventative?
Bro, I was just having this conversation today.
Hmm.
They pay the most on our procedures that we do primarily to address things that have already happened.
Mm-hmm.
So we're treating things after the fact, and they pay so little on prevention. And I think that's our healthcare system in
In
general.
general. Yeah.
So there's no incentive for me. Like, yeah, we talk about, hey, oral hygiene instruction, water jet, floss, blah, blah,
Right, right.
blah. But you also realize that if everybody started brushing and flossing and decreased their sugar, we wouldn't have jobs,
We wouldn't
right?
have lucrative
We
jobs.
wouldn't have lucrative jobs. We
We
wouldn't
would
have
still
that
be sitting
yacht.
there
We
going,
wouldn't have,
"You're doing it. Keep
you
it
do it,
going."
right?
We'd be cheerleaders.
And so that's where I struggle with, you know, how can we incentivize the person who has to pay bills, pay their loans? If you got your own office, you got your employees' wages, your materials, like you have to pay bills to survive, whether you're an owning dentist or not. But the model incentivizes symptomatic care versus preventive care, which is counterproductive to the benefit of our patients. So how do we put those two together on our own? We know the industry is going to be the industry. It's going to be profit driven. You know, how can we as individuals change how we practice and still make a good living?
That makes sense. And do you think that we're taught in school more reactive fixing of stuff versus prevention of stuff? Because
Oh, women. Yeah,
I remember in dental school, we had to sit with our patient that smoked and talk for like 15 to 30 minutes about smoke cessation
right,
and preventing smoking and let me show you the brochure that you can use to stop the smoking habit of yours. I remember
right,
that. Like if the teacher saw that the patient smoked and you didn't go over cessation, then you're sitting there like, oh, go talk to them and you'll be okay.
right,
I don't even know the last time I even did that. I mentioned it to patient like, listen, if you want to heal, we have to start. And this is our consultation. But I'm not.
right,
I don't spend 20 minutes talking to them about like where they can get information about how to stop smoking, or
right.
do they need to go buy nicotine patches, gums, whatever it may be. I don't do that
But let's say there was a model in which for that you got reimbursed and it was a decent
for my
amount
time.
for your time.
Okay.
You would probably do that, right?
Yes.
There's a lot of stuff I feel like we would do if it was
That's right.
built into the model. Because right now I can say I want that, oh, I want to spend so much time talking to my patients and getting to know them. And the only place I've been able to do that is residency because I'm not driven by because I'm paying to be here.
Right.
I
Right.
don't necessarily have to be super productive,
Yeah.
right?
But
And
who actually does pay? Do you know who insurance actually pays to do that?
mm,
MDs,
oh,
primary care. They
yeah,
always talk about, oh, I talked about weight management. I
right.
talked about this. Right, and they get paid to do that.
No, don't even get me started, bro. You got kids. This is how they trap you. You go in for their wellness visit. They do the wellness visit, which
Hmm.
is the checklist of all stuff, and then they say, "Was there anything else you wanted to talk about?" That's the freaking trap. Because anything you talk about, oh yeah, their knees been hurting. You get a bill in the mail for like $400 for a You're like, oh well, that's outside the scope of a wellness visit. She asked me. I didn't volunteer the information. So now you learn as a patient, like, okay, if they ask me if there's anything else, nope. And you look at your kid, you be like, you better not say shit. Nothing. Don't say nothing.
You like leave limping. you're, you're like leaving on a crutches. No, I'm still fine. I'm not talking to you about this.
No.
Get my wheelchair real quick. Yeah, no, I mean, you're right, and that
Yeah.
could be a whole topic of just what we need to do, because I honestly think we've become more of a repair
Mhm.
service versus a repair preventative service.
Right.
But we still have more questions than, and I'm sure we'll get derailed by other topics next time, but we'll try to get to these questions. So we got 2 out of 10. Excellent.
In an
We're doing
hour.
well.
Wow, that's a record for us.
We're doing well. We are absolutely not distracted by other stuff that we cared about. Good. Well, hopefully we got to your question.
Right.
Patient 1 and 2.
Right.
Forget the other 10. If we had a talk show, we would be the worst. We probably would
Yes.
not have that show for a long time, because we would never get. Oprah was good at asking the audience questions, like, "Oh, what do you think?" I
Right.
also be like, "Let me tell you what I think."
Right. We would have a guest that'd be waiting for their, the last 15 minute spot that would always just never, that we'd always run out of time.
We'll bring John Smith back on next time to talk about what we mentioned last year. But yeah, no, okay, we'll get to. Okay, I'm not even gonna say I promise we'll get to more, because we probably won't. So let's not lie. We'll just keep trying to answer these questions until we're done. That's it.
Exactly.
You know what I mean? And in between, we'll have people coming on to kind of give everybody an insight to dentistry and what's going on, like we always do.
Yes.
Yeah, and then we'll
But we got a big announcement, man.
Oh
I
yeah.
don't know. Do you remember back in the day there was this huge fight? It was Ali Frazier. And they had
If you're a
multiple,
certain age,
right?
if you're a
Ali
certain age,
Frazier.
yes.
You had Mike Tyson versus Evander Holyfield or Sonny Liston, right?
Right.
In our day and age, we had Pacquiao versus Mayweather.
That's right. That's
Okay.
right.
We've got a fight coming up, and I think we need to tell the world
We do.
about this battle. So, me and my man, Dr. Walter Aka,
Uh-huh.
are engaging in the great debate of 2024 in Vegas
Uh-huh.
at the National Dental Association
That's
convention.
right. That's right.
And just like Ali Frazier, you've got your pretty boy, skilled, float like a butterfly, sting like a bee,
Uh-huh.
doctor.
Uh-huh.
Quick with my wit,
Okay.
right? I can,
Okay.
and then you got your hard-nosed
Uh-huh.
Philadelphia,
There it
Pennsylvania,
is.
forehead down, lunge forward and just kind of throw stuff, see what sticks at the wall.
Okay.
We're going to see these two great people
Got you.
go at it live
Got
on
you.
stage.
That's it.
I think we're slated for the 27th, but I'll get the details and we'll do some
Right.
promo work.
So
But tell us about this debate, Walt. What are we going to be talking about?
what this fool is trying to say is, in dentistry, there are so many different things that we can't decide on, right? If one doctor looks at an extraction, or I'm sorry, looks at an x-ray or looks at a picture of a tooth, they might say, you know what, let's take this out. Another doctor might say, no, we need to keep this tooth for as long as possible.
Right.
And we go back and forth. And most of the time, we're supposed to base everything off of research. We're supposed to base everything off of our clinical judgment as well. So that combination of what we've been learned, what we've been taught, and what works in our hands and what works for the long term, right? So what we're going to do is we're basically going to be given a picture, and then I'm going to fight for what is right, fight for what is natural, okay? Not a BBL, but squats, okay?
A
gonna
dental
fight.
BBL.
You are the BBL. I'm gonna fight for natural beauty. I'm gonna fight to try to keep this tooth while the doctor with the heavy hands, the doctor that just wants to replace everybody with as androids, is going to fight to take this tooth out. So if anybody's interested, we're gonna get together in Vegas for the prime time show. And
Yes.
I'm going to be on the side of good. And I'm going to be on the side of keeping your body the way God intended. And Dr. Horton is going to be on the side of we don't know. And he's going to
Well,
take teeth out. That's what
well,
he's going to do.
listen,
I'm not
I'm going to be
biased.
on the side of the government is trying to microchip you, and they're putting microchips in the dental implants now, so we know what you're doing, where you're going.
And for all my holistic dentists, I'm on your side. I don't believe metals go in your mouth. No. Let me stop. No, but I think it's going to be a lot of fun because
That's going to be fun.
what we're doing is basically trying to, and I want to say, and I'm going to say this probably even then, is no, there is no right answer. It's
Exactly.
just a matter of let's give you the facts. Let's try to convince you that my side or his side is the side you want to go on based on all
Right.
the information we give you.
The
And if
better
we do
way.
if we do our job, you're going to come out going, I can now look at another tooth and actually think of both sides versus me always going one way or the other. We are going to try to make you a well-rounded professional.
Right. Or you might come out and you be like, man, that Leroy is just a handsome devil
That's
with
right.
a silver tongue,
That's right.
knows his shit.
And you're
Who was
98
that
years
other
old.
guy?
And you're 90
Who?
years old and you're like, man, look at that. That that handsome little that man up there with that silver tongue because only 1950s and older talk like that.
Yeah,
Okay.
what a whippersnapper.
Exactly. So for the seniors out there, Dr. Horton will be there. But no, I'm excited. I think there's gonna be a lot of fun, and we'll basically get more information and detailed information. So everybody should come out in July to just at least, if anything, we're gonna entertain you.
Absolutely.
If you learn nothing, you're gonna learn that I'm right and he's wrong. Yeah, I mean that's it. And the more people that vote for me, I'm not gonna sit here and say I'm going to be bribing people, but I'm gonna be bribing people. We don't know.
Are you handing out M&Ms?
You
You
know
like,
what?
hey, you vote for me.
There
you
I might
go.
slip a little
There you
something.
go.
No, it should be a good time. I'm excited.
Absolutely.
Just again, in the end, we're gonna basically allow people to kind of think through treatment plans, and
Exactly.
patients are gonna be served in the end because they're gonna sit there
Exactly.
and say, "Oh, I actually saw this case, and I actually think we can save this tooth," or I actually say, "Hey, based on what I learned, we might need to go with this implant part." But guess what? In the end, the patient is gonna know why.
Exactly.
And that's what we're trying to do. We try to be funny, but in the end, the patient is going to know why.
Patient is going to win. That's what it's all about.
That's it. That's it. And I'm going to win. But that's another story for another day. Well, hey, let's go ahead and call it. I appreciate you.
Yes, sir. All right, man.
All right. Thank you for listening to this episode of Truth Be Told. The opinions on this episode are just that, our opinions. Please consult your dental professional before taking any action with your dental health. If you have any questions about anything you heard on this episode, please contact us at Real Dentist with an S. That's REAL Dentist with an S at gmail.com. We would be very happy to return any message that we receive because we love the communication that we have with our listeners.